Yeah, Anthony, I think that there's no emergency situation that the public cannot do anything. Actually, if anyone comes across a colleague or a friend or a family relation that is having an injury, and the injury appears open, that is, you suspect that the patient may have a fracture, and then also there's a wound on the leg. I think the thing to do is to, number one, quickly, let me just put a scenario. Sometimes you may actually see the fracture. You may see a bone sticking out of the leg or whatever it is. What you just do is just try and immediately just try and see whether you can put the bone back inside the flesh, if it's possible. Yes. If it's not possible, but just, pushing it back. If it's not possible, just get any clean material. It can be a piece of cloth, it can be a handkerchief, it can be anything that is at least clean. Make sure you just put it on the wound and then secure it with maybe a bandage if you can get one, or another piece of cloth, whatever it is. And then when we're talking about the treatment of fracture, we said you should splint the fracture. You secure the leg in such a way that it is not shaking too much. So that in that instance, if you have something like a cardboard or a straight plank of wood, you just put it beside and then bandage it to it, just to make sure that the bone does not dangle about. In some special situations, the bone, some part of the bone may actually break off and be extruded from the body. If you get that kind of bone, it's also important that you can just retrieve it, wrap it in a piece of cloth, and then transport that injured person to hospital immediately.
Wash 94.9 FM.